Our opposable thumb is said to be the key to human success as a species. Our hands are uniquely helpful and expressive parts of our anatomy. Research over the years has shown that the unique configuration of your hand and fingers gives nuanced insight into many aspects of not only your ancestry, but also recent events from your fetal development to your occupation. An initial test can be done by touching your thumb to your little finger. Do you observe a long, thin muscle popping out on the inside of your wrist? If not, then congratulations, you are a mutant. You are missing a muscle that once made it easier to swing from tree branches. Our orangutan cousins still possess the muscle, but as we usually don't need to swing through the jungle like Tarzan, us humans are evolving without it. This muscle is absent in about 15% of humans and is an example of the way evolution is an ongoing process. As humans change at genetic and physiological levels, scientists are already finding minuscule changes in the makeup of our bodies. Many of the evolutionary changes that our species is undergoing are subtle and have more to do with characteristics fading away that are no longer helpful. In the case of the absent forearm muscle, researchers think we're losing it because it's a waste of developmental energy to produce a special tree-swinging muscle. So we're evolving without it, as with wisdom teeth and jaw structures that contain large muscles for chewing tough foods. Researchers are finding that a quick study of the hands, in particular the lengths of the index and ring fingers, can reveal a lot about a person's personality and risk of disease. The size of the hands and fingers are of course linked with ethnic and gender differences. However, the shapes and parts of the hands and fingers have been found to be an important indicator of specific developmental features laid down in the fetal and postnatal stages. Because the hand is always in sight, it is seen to reflect character and aesthetic appeal almost as uniquely important as the face. The size of the hand is not only linked with the gender and body proportions of persons, but apparently also correlates with the occupational and cultural background of the individual. The 2nd to 4th digit ratio is thought to be related to a range of traits which include cognitive ability, disease susceptibility, and sexual preference. It has recently been found to be a predictor of sporting ability in women, while one study has even linked leadership personality traits with the measurements of the hand. These aspects of your fingers and hands are determined way back during your fetal development. Pete Hurd, a neuroscientist at the University of Alberta, says that during the fetal development of boys, there is a surge in testosterone in the middle of the 2nd trimester, which seems to influence future health and behaviour. One easy-to-spot indicator of this flood of testosterone is a ring finger that's significantly longer than the index finger. Scientists are not yet able to factor in finger length to conclude particular diagnoses, but they have found evidence which shows how this prenatal hormone variation can affect a person for life. Its effects may include increasing or decreasing your risk of particular diseases, to predicting how easily you become lost or display anger. Scientists continue to research what sparks these hormonal changes and have started looking at environmental chemical exposure and maternal stress levels and diet. It's probably then a reasonable assumption that finger length has some impact on your personality, as some writers have suggested. HuffPost contributor Cassandra Lewis has devised a simple plan for checking what your fingers say about you. Straighten out your left hand and compare it with these images. Hand A is when your ring finger is longer than your index finger, while if you have hand B, your index finger is longer than your ring finger. Or you may have hand C, which is when your ring and index finger are the same length. Though verging on the pseudoscience of palmistry, the scientific basis for finger length and analysis may well justify a loose extrapolation of personality traits. Lewis suggests that those with hand A are confident, charming and risk-taking, even at times aggressive, and they are perfectly suited to an occupation such as soldier, salesperson or CEO. If your index finger is longer than your ring finger, then you have hand B. She states that this indicates you are a natural-born leader, quick-thinking, resourceful, even-tempered and confident, and that your perfect profession is something like politics, teaching, or authoring self-help books. Hand C is where your index and ring fingers are of equal length. This makes you a good communicator, a balanced and compassionate person whom others feel safe to confide in. An ideal job would be nurse, social worker, or therapist. A more scientific analysis has been put forward by Hurd, who found studies using mainly the right hand. To do this, you measure your index and ring fingers from the base to the tip. Divide the length of your index finger by the length of your ring finger to determine the digit ratio, or finger quotient. A longer ring finger results in a finger quotient of less than 1 and a more masculine hand shape. Studies have linked the presence of this longer ring finger with increased verbal aggression in both men and women, as well as improved athletic ability. In other words, the shorter your index finger, the more acerbic your self-expression and propensity for verbal sparring. A greater input of prenatal testosterone can be an indicator of high levels of proficiency in sports, in addition to mental toughness in athletics. In one study, both male and female college varsity athletes were shown to have shorter index fingers than other students. In women, the more masculine digit ratio was seen to predict a better sense of direction, supporting previous research that found better spatial cognition tends to be a masculine trait. Men with shorter index fingers were also more likely to pick fights, and women with the same hand shape were more likely to respond with aggression if provoked. Another finding was that men who have been subject to a higher surge of prenatal testosterone and therefore have longer ring fingers tend to be risk takers. One example found was that the most successful financial traders tend to have the longest fourth digits, although in this case the behaviour patterns seem to apply only to males. The longer ring finger does have its downside, possibly being a sign of knee osteoarthritis risk, particularly in women, in comparison with people whose fingers are equal lengths or who have the longer index finger. By contrast, people with very little difference between the index and ring finger or having a longer index finger seem to be overrepresented among men with oral cancer compared with others, according to one all-male study. Men who have long index fingers and shorter ring fingers carry a 33% reduced risk of prostate cancer, and if they're younger than 60, the risk is reduced even more, by 87%. The evolution of the human hand continues slowly over the generations, but scientists have found a strange example of that evolution actually going backwards due to our technological advancement. Scientists at Australia's Adelaide University recently discovered that more and more people are being born with an extra artery in their wrists, one that usually disappears early during gestation. The artery shares space with a nerve which passes through a structure called the carpal tunnel, and people having this extra median artery are more likely to develop painful carpal tunnel syndrome. In our evolutionary past, even only 100 years ago, it was a disadvantage to have this median artery because if people worked hard with their hands, it could lead to carpal tunnel syndrome, which would endanger their livelihood and survival. However, with the modern advent of the straightforward treatment provided by carpal tunnel surgery, the median artery is no longer the liability it once was. A condition that once was disabling and would make it hard to work in the fields or factory and thrive is suddenly not a threat to survival. Accordingly, while only about 10% of people born during the mid-1880s retained their median artery, of Australians born in the late 20th century, 30% of people now still have it. Professor Maartje Henneberg at Adelaide Uni says it shows our rapid microevolutionary change. If a particular trait makes it more difficult to survive or reproduce, that trait is less likely to be passed down. However, human medical technology is altering mutation selection balance. The study even predicts that people born 80 years from now will probably all carry a median artery if the trend continues. Henneberg calls the process relaxed natural selection.